intermittent fasting, and apple cider vinegar. I'm now at 18 and a half pounds down since October 8th. Today is November 12th. Yeah, just confirming. Getting rid of a fatty liver takes some severe determination. I mean, I have strict adherence to the guidelines set forth by doctors, experts, etc. And the results have been nothing short of amazing. One of the things I do want to talk about, especially if you have fatty liver and you're in your 40s and you've been diagnosed with this, understand you probably have some other symptoms as well that went along with this. I know I did. I had GERD. I never went to the doctor and got prescribed medicine for it, but I knew I had GERD, which is gastroesophageal reflux disease. It's just a fancy way of saying you're eating like crap, you're drinking too much beer, and therefore you have indigestion. And anyways, they like to put a label on absolutely everything. Doctors, any sort of problem you have has to be classified with some sort of medical diagnosis. But nonetheless, I did have GERD. I did get rid of it. I used Bragg's apple cider vinegar. That's the one that has the mother in it, which is just, the good bacteria. I'm drinking this morning. I've gotten into the habit of doing it because it does such a good job of curbing appetite. I don't feel like I'm going to have, an appetite problem, but I am going into an engineering firm today, and they no doubt will have boudin. There will be kolaches and crud like that, all sitting out, brought by vendors. I mean, I don't eat that stuff, and that's one of the reasons. I mean, I don't eat it anymore, but I would have when I was 230 pounds. So anyways, the GERD was completely erased within about week one. I would say by like October 16th or 17th, GERD was gone. Now, is that attributed to the alcohol? Yeah, it's probably part of it, but I don't think I would have kicked it so quickly had I not been taking daily. And I was really kind of overextending. I know they say 2 tablespoons a day. Man, I was probably doing 4. So I took so much apple cider vinegar that I could feel a little bit of burning in the back of my throat. So you got to be really careful with that. The doctors say, yeah, that's too much apple cider vinegar. So I scaled it back, went back to 2 tablespoons a day. But I had really exterminated, this GERD problem. It's amazing how quickly this worked. And GERD is not as a result. You don't get GERD because you have too much acid. GERD is because you're not producing enough acid. Your proton pumps, right? These acid pumps inside your stomach. I think it's proton pumps. I don't know. I may be describing it wrong. These acid pumps don't work well when you're piling liquor on top of it. These pumps, all right, if you're getting sprayed with alcohol, just stop working. Therefore, you're not producing the acid that your stomach needs to digest your food. And then if you're putting crap in your stomach, right, the pumps themselves are starting. I mean, they just start to wither away. So, this is just one further thing that you are going to experience on your journey, cleansing your liver, getting the fatty liver down, getting the fat out of your liver. And I do notice, and you may have noticed it too, there's some little phantom pains in the liver area. I've looked that up. They said that is a side effect of purging junk out of your liver. It's not junk, it's just fat. So I just thank God. I thank the universe really for bringing this to my attention, that I have a fatty liver and that I needed to change my ways. I look at it as a remarkable thing. I couldn't have tackled everything the way I did. I started taking choline. I started taking N-acetylcysteine. I didn't do milk thistle. I did the choline, N-acetylcysteine, and then I'm taking an omega-3 krill oil that I got from the vitamin shop. And I try to do that every day. I don't always do it. I mean, simply by changing my eating habits, I know that I'm doing the right thing. I couldn't have done any of this without the help from people like, Dr. Eric Berg, Dr. Jason Fung, comments by Dr. Mark Hyman, having a few of the medical experts behind all of us when we go through this, it's so comforting. I don't feel like this is some sort of witchcraft or new age or Ayurvedic or homeopathic medicine. And I know that Ayurveda and homeopathy do they come in, they probably have, if I had looked at the history behind homeopathy and Ayurveda and how do they cure stomach ailments like this, probably very similar. But nonetheless, I followed the science of doctors who were tired of watching patients come in and then dying. Especially Fung, because he's up in Canada. He's a kind of a socialist doctor. He's in the socialist medical system. He sees this wave, this trend from 1980 forward of people coming in, and he's just giving them a death sentence he prescribes them the American Diabetes Association prescription for losing weight, which is actually, it does the opposite. It makes them fatter, it makes them more uncomfortable, and then they pass away. Of course, you lose limbs on the way, etc. So I look at my fatty liver as pre-diabetes, almost like a pre-diabetes, like a prescription. It's a prescription for death. It would have been early death for me. I know I have friends that laugh at me, go, "Oh, you're not drinking anymore. What's that like?" And I don't miss it. I don't want to keep drinking if it's going to kill me. Now, I did ask the doctors about it. I said, once this is all cured, can I have an occasional glass of red wine or something like this? They said, absolutely. You can enjoy a beer here and there. Absolutely. You don't have to completely abstain. So I'm going to be respectful of that. I always enjoy wine, so why not? Anyways, it's one thing I don't want to just cut out of my life as a result of this, but I sure do like the eating. It's not complicated. Everybody thinks it's bacon and eggs. Man, I got tired of bacon and eggs after about week 1. It's really about putting fat on vegetables. I love broccoli and kale, and I like cabbage cooked in butter. And you don't necessarily have to put like pork sausage on it. You can put chicken thighs. You can put chicken breasts. You can put sliced beef. You can put anything that you want to. Seafood. You can put any of that stuff on there and enjoy that. I really pay attention to leafy greens. I have to get that every day. And the other thing I have to say, and I've said it before, an electrolyte supplement while you're going through this and purging your liver is super important. Dr. Eric Berg has an electrolyte supplement, and I paid for it myself. I went through, I think, Amazon, and I got it. It's $20, but it's a little scoop, and you put that in there. It's about 1,000 milligrams of potassium, some magnesium, and another one of the electrolytes that you need for good heart function. I found that is the thing that helps me the best to sleep. So I drink it at night. It's a little sweet because he put some stevia in there, which is nice. It's like a nice treat to have something that tastes kind of like a sweetened fruit punch while you're having your 6 o'clock meal. And as long as I do that, and I go back up and go to sleep, man, lights out. I'm averaging somewhere like 8 to 8.5 hours. That's another side effect of cleansing my fatty liver, is I'm sleeping so much better. All these things, they're so great. Rather than taking a pill for each of these to cure fatty liver or to cure the symptoms associated with fatty liver, because I think I would have been taking something for GERD. I would have been taking something, no doubt, to lower cholesterol in the blood, which is BS. I know my LDL is up because my brain is working better. And you need cholesterol in your system. This myth that you need to have LDLs at 20, 30, 40 is BS. All these doctors are saying in 200, you're fine. At 220, you're fine. At 250, you're fine. You can go into the 3s and be fine with LDL because your body makes cholesterol. You don't get that from food. And any less that your body has to make, you can supplement with food. So yes, I know that my LDL is at a good level, a healthy level. My HDLs, all that good cholesterol, bad cholesterol, it's bunk. It's bunk. And these doctors are all claiming so. They're all seeing undisputable evidence that it's complete crap. That everything that's been taught to you by the USDA and the FDA and that frickin' food pyramid, that is a death sentence for Americans. Just look around, go to a mall, go to Walmart, go to your shopping center, go to where you buy food. It's terrible. It's a criminal act being performed on 400 million Americans. And it's destabilizing of our economy. It destabilizes healthcare. It costs you and me a ton of money for doctors to continually go, yeah, I'm going to prescribe you metformin and I'll give you more and more insulin, when Dr. Jason Fung is reversing type 2 diabetes in people in as little as 2 weeks just by adhering to intermittent fasting and a keto diet. Now, you don't have to follow a keto diet. If you're somebody who's like, I can't live without white rice, I can't live without my mashed potatoes. Well, I feel bad for you. I mean, those things are bad for you. They're very bad for you. But you can continue to eat them as long as you only eat twice a day, maybe once a day. I'm just saying that your fasting is easier when you have fat in your system and no carbs. If you have carbs in your system, you're going to be having these huge swings with hunger pains. And then you'd have to supplement with your apple cider vinegar and, like I do in the morning. I do it because I love how it tastes, because I love kombucha. So anyways, I think this is week 6. Anyways, if you have any questions or comments about your own journey with fatty liver syndrome, put them down below. I've named the physicians you can go and reference. You can look them up on YouTube. I've told a ton of people who ask me how I've lost weight so quickly. I mean, the other byproduct is how my skin feels, because obviously I'm sloughing off fat, and my skin, which was normally like drier than the Sahara, I'm sure if I looked at a black light in my bed, it probably looked pretty gross with the amount of skin coming off my body. I mean, that's a clear sign of your liver's unhealthy. So this has just been fantastic. So thanks a lot.